Buongiorno, ciao a tutti quanti e grazie del gentile invito. Sono molto riconoscente all'amico Nicola D'Alessandro per avermi invitato. Purtroppo non posso essere presente per impegni precedenti a Potenza, ma vorrei mandarvi un caro augurio dagli Stati Uniti, in particolare da Chicago, dove è ancora molto freddo e quindi siamo tutti gelosi del tempo che probabilmente ci sarà in Italia. Vi presenterò alcuni dati della nostra esperienza in chirurgia robotica. So che il dottor D'Alessandro ha cominciato un programma di successo e veramente i più cari auguri di continuare lungo questa strada, e vorrei appunto aggiungere i miei commenti sulle prospettive future di questa tecnologia che nella mia opinione rappresentano veramente il futuro della medicina.
The topic of this presentation is the surgical perception in the era of digital tissue interaction. That is a very complex definition. We have been used for centuries to touch organs and with our hands and our fingers and to decide the position of a tumor or the presence of an artery. But the perception of tissue perception is a very complex action, and it's a kind of philosophical definition. Perception is the identification, organization, and interpretation of sensory information in order to represent and understand an environment. Surgical perception is a mix of complex proprioceptive, tactile, thermal, and visual information. And the surgical perception has been changing for years, and if you think about the open situation when you are using a combination of visual information and tactile information, thermal information, and of course this kind of analogical relationship between the sensors and the brain of the surgeon and the surgical target has been there for a long time, and there are limitation in visualization, limitation in the information that our senses are able to give us in order to perform the most precise and the perfect operation. Laparoscopic surgery introduces some changes in this kind of surgical perception of tissue. The touching of tissue is indirect through the tools. There is no thermal information at all, and the visualization is basically a 2D visualization, but with some magnification capability and achieving the possibility of looking at the target with more and more favorable angles. In